Hello, my name is Paul Grabowski, and I'm here today to talk with you about the purpose of nursing. So, I suppose we should start with, what is the purpose of nurses to you?
The purpose of a nurse to me would be if I was at the hospital, I would hope to be treated with kindness, dignity, and that they would follow the doctor's orders and instructions for my care.
Okay. Do you believe that nurses are there to give you your medications?
Yes.
Do you think that nurses ever make decisions on how to take care of patients without doctors?
I believe, yes.
Okay. And I guess the next question I have for you is, do you think that nurses are a profession? Do you believe nursing is a profession?
Yes, I would say yes.
Okay. Why do you think that nursing is a profession?
Well, they are required to have a lot of education about all things about the human body, I guess.
Okay. Yep, we're going to get into that soon. So I would like to present to you that nursing is indeed a profession. It functions independently or collaboratively with doctors and other healthcare professionals. But the question is, why is it considered a profession? And to delve into that, I believe we need to start with, what is a profession? So a profession simply is a career that requires several elements. And I'll explain those to you now. The first element would be a body of knowledge or theory and education on that knowledge and theory. Second would be a mission. Third would be a social value that is valuable to society. Fourth would be it has a culture or community with expected ethics and practices. Then we have the element of autonomy. A profession governs itself with ethics and standards. And in that governing, there is the next element, which is accountability. Those in violation of the standards can have their professional credentials revoked or disciplined. And then finally, there's compensation. And professionals are to be motivated by commitment to work over just personal gain or money. So, how is nursing a profession? Well, I will show that to you now, using those same elements. So, the body of knowledge or training. What knowledge or training do you think that nurses need?
I would hope that they are very educated in, well, first off, how the body functions, what different reactions different medication would make. Yeah, those are just two off the top of my head.
Okay. So, yeah, you actually are starting off with one of the first points. To become licensed, nurses must study the human body, biology, microbiology, and diseases of the body. Beyond just how the body works, nursing theory exists that is based on clinical trials and research by nurses with advanced graduate degrees like doctorates in nursing research. Nurses use this information to find the best solutions to help patients. In addition, advanced practice nurses must take advanced graduate degrees to have knowledge to prescribe medications and function in a similar role to doctors. You may have you ever heard of these professionals?
Yes. Mm-hmm.
Okay, do you know what they're called?
No.
They're called nurse practitioners, or nurse midwives are examples of these professionals, beyond just the standard nursing professional. Next, we have mission. Nurses have the caring mission of maintaining or nursing patients back to the patient's best possible health. In addition, nurses help communities improve their general health through community programs or outreaches. And what about social value? What social value do you believe nurses have in Pennsylvania?
I would hope that they would first follow HIPAA, that they would just be professional enough that they would react always in a professional way, even when maybe a patient is acting out.
Okay. All right. So, as we talked about in the mission, nurses are vital to the health of you, me, and our local communities. And why? While doctors write the initial orders, nurses take care of you and me, and they must watch for changes in our condition closely. They must also plan how to avoid complications that frequently arise from certain conditions, and they also need to suggest actions or medications to the doctor or nurse practitioner to help you and me recover or stay well. They can literally save your life by catching problems early or preventing them altogether. So what about culture and community? Did you know that if a nurse fails to pay child support, gets a DUI, driving under the influence, or is convicted of theft, they can lose their license?
Only because I read over your notes, did I know that?
So, yes, this can actually happen. To be licensed as a nurse in the United States, you must meet and maintain an ethical lifestyle and also pass the NCLEX. And the NCLEX is a test that checks if you understand how to think critically in complex health situations and also have the knowledge that is vital to being a successful nurse. So then you have autonomy and accountability as the next two elements that I'd like to discuss. So if a nurse would need to have their license revoked, who would do that?
I'm not sure, to be
Okay,
honest.
that's fine. That's why I'm here. Nursing as a profession is not governed by doctors or hospital administrators. Rather, it is governed by bodies like the NCSBN, have their little logo there. They are the National Council of State Boards of Nursing. And they have discipline programs. The individual state boards of nursing have discipline programs for nurses with addiction issues or other behavioral issues that can lead to revoking that nurse's license over time or even immediately. On the other hand, they can also, with those discipline programs, help bring a nurse back from issues and help them regain their ability to practice as a nurse again. So in that, you see there's the autonomy in that nurses are regulating other nurses, and also the accountability in that nurses can lose their licenses if they do not maintain that ethical lifestyle or way of life. And then finally we have compensation. True nurses do not practice nursing just for money and personal reward. Rather, they began nursing to perhaps help other people or to have a professional career, and nurses must always value their patients over just money. And if there's been shown a action that a nurse took that they put their own personal reward over a patient, they could lose their license for that also. So, in summary, nursing is a unique and vital profession for the health of your family, my family, and our community. It independently continues to improve through research and accountability, and also improve through the practices of individual highly skilled nurses. And these nurses just might one day save your life or mine. Thank you.